And welcome back to Health TV. A very good morning to you. Well, I'm now joined by Liz Ashall-Payne, who's the founder and CEO of ORCHA. Liz, what is ORCHA? What does it mean to the health community?
Okay, so ORCHA stands for the Organisation for the Review of Care and Health Applications. And it's born out of the fact that there's currently 170,000 health and care apps out there. And every day we see 4 million downloads of these apps, which means that our citizens and consumers of their own health are downloading these products. And when asked, professionals and clinicians, 93% in fact, say that these products could really help with patient health outcomes and population health outcomes. So we have a real problem because it's not systematically being used within the NHS for the benefit of patients and populations.
It's amazing that these apps can actually help. I mean, I'm new to all this. I mean, you think to yourself, you take out your phone, you have a look at it, and you've got all your apps on the screen and that. But there's stuff that can help you with health.
Absolutely. And the problem is which one do you choose? There's 170,000. And when you go to the app stores, you type in something like diabetes, you might get 3 or 4, when actually there's 3,000 diabetes apps out there. So to try and support and solve that problem, what we do is we review the apps for you. And it's quite a detailed process that we go through. But in essence, the reason we review the apps is so that clinicians and professionals can feel confident to search, compare, and then recommend apps. People, like all of us, can then find the best solution for ourselves. And also, we want to promote the best apps to get the best results.
What are you looking for then in the ideal app? If you're going through all these reviews, which bits are you discarding, which are you keeping on?
Okay, so our review process is quite a lengthy process. So every week we do an automated data scrape which pulls in all 170,000 health and care apps. The first thing we do is we apply a did not qualify filter which gets rid of redundant apps. And the reason that's important is because if an app isn't updated or maintained, then it could be full of glitches and data security issues could be found. That gets rid of 90,000 apps. Then what we do is we curate them, so we work out what does the app do. And this is really important for being able to search for an app because an app name doesn't necessarily correlate with a condition. Once we've done that, we're then really looking at data safety and security. We're looking at clinical validity and academic robustness. We're looking at design and testing processes that the app's gone through. And we're also looking at user feedback.
That is quite a stringent requirement, isn't it? I mean, people all over the place making these apps, putting them on the market, and you're there making sure that they're passing all these stringent requirements. That's quite a big ask.
Well, absolutely, and there's currently 2,500 standards out there. And so it's a challenge for anybody who's developing a product to know about all of those standards. So what we've found is that all the communities, clinicians, healthcare organisations, consumers and app developers really welcome this.
How will Health TV and the community partnership add value to your current offering then?
So what we do is we help people to find, compare, search and then recommend apps. And that's brilliant. But for an individual, either a clinician or a consumer or even an app developer who wants to know more about a product, where do they go to find out more? At the minute, Google is their friend. But what this offers is a really quick way to find more information about specific innovations in a really accessible way.
Well, we've actually got our own app on the way as well, Steve, haven't we?
Yes, we have indeed. So I hope that gets a favourable comment from yourself, Liz. Just the Health Community Partnership recognise companies like Liz who are at the cutting edge of the health sector with, helping them, supporting them and bringing out the right outcomes. And we're looking for these type of partnerships and these relationships and build on them over and over again to make this grow. And the Health TV, the Health Community Partnership, CIC, sort of support and companies like Liz's to get the messages out there to the people and a visual message as well that's very quick and accessible, on demand even.
Liz, is the Health TV app going to pass muster? That's the question.
We'll have a look.
Yeah, Steve, it'll have to pass plenty of tests.
No pressure there.
No pressure there
None
then
at all.
Now, you've got a memorandum to
have.
sign as well, haven't you, this
Indeed.
morning? And whilst you're going to do that, I'm going to say thank you very much for joining us this
Thank
morning. It's the first ever broadcast of Health TV. We do hope that you've enjoyed it very much. Please contact us if you have any contributions to make in terms of videos, news, or even if you have an event, conference or exhibition that you'd like us to broadcast. Thank you so much for coming in this morning.
you.
And to you, Steve.
Thank you very much, Andy.
And from us all here at Health TV, have a good morning.